How is MBI helping the fight against breast cancer?
MBI is fighting breast cancer in a very important way because it's helping us create more breast cancer survivors. If we find breast cancer at an early stage, the survival rate is 98%. That is so much better than it used to be. Cancer used to be a death sentence. It's no longer a death sentence. How MBI is helping us is because it allows us to find cancers at an earlier stage, especially in women with dense breast tissue, because it's a challenge to find those early stage breast cancers on mammography. So with MBI, we find it earlier, and we're finding it at a time where we can have an easier time treating it and curing it, and we're reaching that 98% level.
Why are dense breasts a problem for screening mammography?
That's a great question, and dense breast creates a challenge for us to interpret it and to evaluate the breast tissue on a mammography. And the reason why it's challenging is that dense breast is white and cancers are white. So dense breast can actually obscure or hide a breast cancer, or it can mimic a breast cancer. And when it mimics a breast cancer, we do additional follow-up and also additional breast biopsies to figure out if it's actually cancer or dense breast.
Something that stands out to me is that not only can MBI see the unseen in a mammogram, but it can also clear up some potential false positives that
Absolutely.
So there are many women out there now who go through this experience of thinking that they have cancer, and I'm sure that you know from firsthand experience how devastating that must be.
It can be your world stops, and to have someone tell you have cancer or need a biopsy is life altering. And so now with molecular breast imaging, we have another tool that can help decide whether it truly needs to be biopsied. And if it does, let's take you through those steps and get it biopsied, because we don't want to miss something. We don't want to hide from something. We want to make sure that we take care of our patients the best way we can. And molecular breast imaging has given us just that additional tool to take care of our patients and treat them as if we want our family to be treated.
I had no idea how prevalent dense breast tissue was, and that mammography could miss those early signs of cancer. And how is MBI changing that?
MBI is changing it because it gives us an additional tool to find the breast cancers as early as possible, which is the key for breast cancer survival. No test is perfect. So adding molecular breast imaging to mammography is helping us find those cancers at an earlier stage when it's the key.
Dr. Mahoney, could you talk to me about your personal experience of MBI?
Sure. Not only am I a radiologist who works with breast imaging, but I'm also the daughter of a patient that has had bilateral breast cancer. I'm a cancer survivor from a different type of cancer, and I'm a breast patient that's had additional workup. So breast imaging and having a modality that can help find breast cancer better than just mammography is very important to me. The story comes for me is that not only do I have dense breast tissue, but I am at high risk because of my mother's breast cancer. And 10 months after colon cancer surgery, I had a callback from my mammogram. And it's a very scary thing to have that callback, but also I get it. When somebody tells you you have cancer, it's amazingly life-stopping. So when I had the opportunity to acquire the MBI machine for this hospital and for my patients, I was ecstatic